Hi, my name is Dr. Julia Brands. I'm a clinical researcher and resident in cardiology at the University Hospital Aachen, Germany, as well as an honorary research associate at the Imperial College London. And what I want to talk to you today is, what is a PCSK9 inhibitor? So a PCSK9 inhibitor is a relatively new lipid-lowering approach to lower LDL cholesterol. And currently, it is among the most effective add-on treatments to statin therapy that are available. So to understand how a PCSK9 inhibitor works, let's take a step back and discuss the role of a PCSK9 in the lipid metabolism. So the only way how we can naturally remove LDL cholesterol from the body is through the liver. Therefore, we need the so-called LDL cholesterol receptors on the surface of the liver cell, which then bind the circulating LDL cholesterol particles so they can be transported from the blood into the liver, where it's then further processed and eventually excreted through feces. Hence, the lower the numbers of available and properly functioning LDL receptors, the less LDL cholesterol can be taken up, and the higher the LDL cholesterol blood level is. PCSK9 is an enzyme produced within the liver and circulating in the blood, which binds to the LDL receptor, and through this ends the LDL receptor's life cycle because it triggers its breakdown. Therefore, the more PCSK9 is circulating, the higher are the chances for binding to the LDL receptor and hence shortening its survival time. Consequently, the absolute number of LDL receptors decreases. Currently, we have two classes available of PCSK9 targeting medications, and both of them are injectables. The first class, which has been around since 2015, are monoclonal antibodies which require biweekly or monthly injection and bind to the circulating PCSK9. By this, they make them incapable of binding the LDL receptor. And the second approach is a small interfering RNA, which blocks the production of PCSK9 directly in the liver. This approach reduces PCSK9 for so long that it only requires injection by a healthcare professional every 6 months after an initial 2 doses 90 days apart. Both approaches are very effective in LDL cholesterol lowering, also in patients with heterozygous FH. So in a meta-analysis, we found that among patients with genetically high LDL cholesterol levels, like heterozygous FH, both currently available approaches targeting PCSK9, so the monoclonal antibodies and the siRNA, achieve kind of similar LDL cholesterol reductions, irrespective of the patient's genetic background, and it lowers LDL cholesterol of about 50%. Hence, the choice of add-on therapy could now be driven by other factors than LDL cholesterol lowering capabilities. For example, it could be driven by the convenience and the patient preference. Therefore, be aware of your cholesterol, get it checked, and find your best treatment option together with your doctor.